Hello, my name is Sandy Leith. I'm the Director of Services at Algoma Family Services. This television series features many of the extraordinary services at Algoma Family Services. I hope you enjoy this show. Hello and welcome to the show. My name is Emily Tremblay and I'll be your host for this segment. Today I'm joined by Algoma, the CEO of Algoma Family Services. Welcome, Ali.
Thank you, Emily.
So can you tell us a little bit about what Algoma Family Services is?
For sure. You know, Algoma Family Services is many things to many people. We're a multi-service agency. It's funded and regulated by government and governed by a voluntary board of directors. We have over 22 different programs, which is really exciting. And I'll share with you just some of the scope of services. Most people would think of AFS as a child and youth mental health service, but we're actually more than that. We provide telemental health service, youth justice, youth addictions, student nutrition, supervised access. We have a whole host of family violence programs and counseling that we provide, and we're also an employee assistance provider.
And so do you have locations across Algoma?
We do. Algoma Family Services is district-wide. We have an office in Wawa. We have an office in Blind River, Elliott Lake. We have space in Thessalon. And we have 2 offices right here in Sault Ste. Marie.
So you must have a number of employees.
We do. You know, the exciting thing, I've been here 3 years now, we've been growing. And so we're about 120 employees right now with a budget of $9.5 million.
First, I want to learn a little bit more about the Community Action Plan for Children, also known as CAPC.
Well, thank you for asking about CAPC, you know, because CAPC is another great example of AFS making good on our mission statement of together we'll improve access to our extraordinary services. CAPC is really a coalition of 7 different partners that help coordinate and provide services that support children and their families. It's district-wide. I think that's really one of the keys of why it's so successful, because within this partnership we really expand our reach. You know, we reach the community much further than if AFS just did it on its own. So that program is really designed to give children a good start in life by ensuring that families get the necessary support, whether that be through some form of counseling, some form of nutrition advice, some form of learning what we call system navigation about what options are actually available for families to get the support that they need. We know that when families get that support early on in life, children do much better. And so we're really excited about that, even more so because that program is celebrating 25 years of service right here in Algoma. We're really proud of that relationship and how that program has grown, and we're really happy about the number of people that have received service and look for that service out in our community.
So now I know there's another program called CPNP. How does that differ?
Canadian Prenatal Nutrition Program is really geared specifically to moms. And so what research has demonstrated and told us is that children who receive support, even when they are still in the womb, will do well later in life. And so that prenatal nutrition program, which is actually funded by the Public Health Canada agency, allows us to utilize resources to ensure that moms get the necessary advice, counseling, and support around things like prenatal nutrition, even postnatal nutrition, looking at guidance around breastfeeding, the importance of adequate support, help, and counseling on a whole host of areas to ensure that children get the very best start.
Shoot, shoot, the good morning train is coming. How are you? Shoot, shoot, the good morning train is...
The Community Action Program for Children is a federally funded program by the Public Health Agency of Canada that addresses the health and developmental needs of children birth to 6 and their families who are living in conditions of risk.
Algoma Family Services is a sponsor agency, and we work with 6 other partner agencies across the district to ensure that programs are delivered all the way from White River and Dubreuilville and Wawa to the east, Elliott Lake and Spanish.
So we act as the sponsor for a number of our community programs. The money flows from Algoma Family Services to each of the agencies within the coalition.
The 6 other partner agencies are Superior Children's Centre, Prince Township Early On Centre, Algoma Public Health, Child Care Algoma, All Star Children's Services, and North Star Family Resource Centre and Early On Centre.
Community Action Program sites adapt their activities and supports to meet the needs of the participants and families that they serve.
The guiding principles, although each program in each location might be unique, the guiding principles are the same across the country in each program, and those principles are children first, strengthening families, community-based, equity and accessibility, and flexibility and partnerships.
We always work with either community centers or schools because that's where we can go into the communities and actually deliver the program.
We are in partnership with many agencies, a lot of community partners, be it churches, municipal government offices, to provide the venue. And also to provide information on the supports and services that they offer in the community.
The CAPC program was created in 1993 in response to Canada's agreement to invest in the well-being of vulnerable children.
We are working with a community that goes from Missinabie through to the Mission, to Hawk Junction and Wawa, and Mishpicotton First Nations.
We are located in Echo Bay, St. Joe Island, Deborah, Bruce Mines, and Thessalon, and we service a different community every single day of every single week.
For the CAPC program, we have an outreach in Iron Bridge, so we service those families who can't otherwise make it to Blind River, and we have drop-in. Our staff has parenting tip sheets that they bring along. They can answer most any question from parents. If we don't have the answer, we will find it for them. And there's a play group, and we also bring snacks out there.
Those sites offer to parents with small children an opportunity to get together with other parents with small children. It helps to reduce social isolation, provides opportunities for learning, and provides social support that wouldn't otherwise be there if the CAPC program weren't there.
For the families, I think it means a lot. They're able to come out and relate with each other and other moms, and it just gives them a chance to allow their children to have that social interaction.
Programs need to support the health and developmental needs of children. However, we're able to offer a variety of programming dependent on family needs and requests in each community.
We tailor our programs based on the needs of the community. Sometimes they don't know what their needs are. So I've been very privileged to have had training through CAPC, Community Action Program for Children, in infant massage. That's a very, very interesting way to draw people in because mummies who are just starting their maternity leave think, oh, what can I do with this baby? Well, through the infant massage, they're building attachment. They're doing all the wonderful things that we want mummies, parents to do with their children. They're also meeting people.
We also offer parenting programs such as Triple P, Nobody's Perfect, Family Math, all kinds of literacy-based programming that parents can engage with their children or can participate in a parenting program that they can learn strategies that will support them in their important role as a parent.
We do on a regular basis what's called family food and fun. So we'll prepare either a lunch or a supper meal. We'll have 6 families registered. So the first 6 families to register will get an activity package as well as a book to take home. And of course a sit-down meal for everyone.
We do community kitchen, baby Picasso, preschool readiness, parenting classes like Triple P, Nobody's Perfect. So they've evolved a lot over the years.
I'm trained in various aspects of Triple P, and I have to say that the most successful group that we do have is the Triple P seminar series 1, 2, and 3. My coworker and I have made it fun and exciting. We find that just 3 sessions is limiting, and we like to extend it to at least 5 to 6 sessions so that the parents have a real opportunity to talk to us and share with us their experiences, to ask the questions. This didn't work, what can I try next? How do I deal with this certain situation? The biggest building block that we try to emphasize with parents is taking care of themselves. That's the most important thing. If you're not well, your family can't be well. So we encourage them to take care of themselves, to take time for themselves. And by just coming to Triple P workshops, they are indeed learning to take care of themselves and to take care of their family as well.
I attended the Triple P for the first time, and that really, I got a lot of inspiration and a lot of good out of it. Triple P it wasn't easy for me. And as my daughter got older, she would be doing things and I'm like, oh, I'm just gonna go look back in the Triple P, like planned ignoring. She was doing something and screaming at me, so I just planned ignored her and told her, when you're done, let me know, I'll help you clean up, and it was good. And resiliency and just, like a lot of things going on at the school, and Triple P is a really good program and people should check into it.
I know their focus is supposed to be on the children, but I mean, how are parents supposed to help their children if they're not in a good space themselves? So they also provide information and support for the parents too, which has been key. So working on our mental well-being and social well-being and all that sort of stuff too. So which goes down to the children.
Every program we did, not only did it help you socialize, but also too, it made me stay calm at home with my kid when I was disciplining her. Like, you know what I mean? I was able to understand, okay, this is a hissy fit. This isn't her acting out. Okay, maybe she's sick. Maybe she's this. Like, you were able to eliminate different things of different problems to a child. Okay, what's the difference between a hissy fit and a child being sick or uncomfortable?
Another program that we did was the school readiness program, the preschool for my now 4-year-old. It helped her get ready for school. She's got disabilities, so it got her in a classroom setting with some people that she knows to make her more comfortable at school. And now that school started, she's doing excellent. So that program really helped her.
They started, many of them, with an infant massage program. They don't want infant massage. They want each other. It's about peer support. We facilitate that.
There's a lot of parents out there who really need a place to go where they feel safe and secure, and we're not judging them. We're just, there to help them out, talk to them, go through things with them, and hopefully put them on the right path.
For new families coming into the district, it gives them a chance to meet up with other families that they haven't met yet, and then it kind of gives them a sense of home here in the district and a sense of belonging, and that's part of what we believe in, right, is the belonging aspect.
With me interacting with these programs helped me to be social, to actually interact with other people. I was able to, it was a major life-changing experience.
The friendships are great. We talk all the time, we hang out here all the time, and we do outreach stuff. So we go to like the fire tower lookout as a group of friends because of the friends that we've made here.
It's good for us parents also to, interact, and interacting with the babies is great therapy. I come here because I find it's a good environment, and I'm still learning. I'm always going to be learning. There's nothing that everybody experiences. We're all in the same boat because everybody talks, and I can say, well, I know about postpartum, or I know about depression, or let me help you, let me guide you along. That's what all the moms do, and we have a great group.
I have to say, one of the best things about my job that I really like is the confidence that they have in me, and that they can share their stories, and they can share their trials and their tribulations that they have within their family life. And you build that partnership, and you build that bond with families, and you're happy for them, and you celebrate all of their successes.
I would read to kindergarten through to grade 1, 2. Sometimes I did some chapter books. Those children that I read to those many, many years ago are now young adults and or parents. And they come up to me and they say, oh, you're the lady that read that story for us, Charlie and the Chocolate Factory, or another book. So time, longevity, they see you, we've been able to give families and children some beautiful memories. So that I feel is something that I have enjoyed. That being said, now that I've worked for Superior Children's Center and I've raised my children, I now have the opportunity and the privilege of seeing my own grandbabies in some of these programs. So it just helps the family blossom and grow.
With the CAPC program, I've kind of been through it in many different angles. I've been a participant. As a young child, I was too sick to be enrolled in a regular daycare setting. My immune system just couldn't handle all the, the germs and stuff that go around. So staying home with my grandmother, the CAPC program was somewhere where she would take me to be able to enjoy and still get that social interaction, even though I wasn't able to attend a daycare setting. So I attended that as a young child, and then I've also volunteered in the program through doing reading buddies with the schools and How Am I Growing clinic, stuff like that. And then I also am now a mom of 2, so I came to the program with my older son who's now in SK, and now I'm attending with the baby while I'm home and while I'm off. So it's been a really great experience to, sometimes you just need that adult interaction, and it's been great for him to be able to, meet new friends and have some time socializing with other kids and adults to help with his comfort level as well.
I think some of the things that parents get from the CAPC program are they don't feel like they've come to a dead end. There's some place to go. They make new friends, which is really important to some of them because they feel very alone in what's going on in their lives.
One of the greatest impacts I've seen with CAPC is the ability for a family to come to a safe place, build a support network, develop some friendships, gather resources without judgment, and find a sense of belonging within their own community.
What I like about the CAPC program is that it's very a welcoming, inviting way for not only my child to socialize with other children, but also for myself to get some of that adult interaction, which is always so important when you're at home with a new baby.
So just coming in and having a coffee, and if we have a lunch and learn, just pop in. Everybody's friendly, their babies, they're all great, everybody's great. It's a great place to be.
This makes a world of difference. It's literally life-changing, because if it wasn't for these programs, I wouldn't have had a clue, not a clue on how to raise my daughter.
So what I love best about the Community Action Program for Children is that it really helps to connect families in the district, and the relationships that I've seen build just from people attending our programs have been phenomenal.
Some of the things I love about the CAPC program is all the new parents and children I get to meet, and many of the children I get to see grow over the years. So that's pretty cool to watch. You see the growth and just how it's all come together.
What I love the most about CAPC is meeting all the new families and seeing the differences and helping them come together as a group.
What I love about the CAPC program is that the program itself is designed to meet specific needs in each community, and the participant feedback is what really drives the content of the programming, of course maintaining the 5 guiding principles.
What I love about the Community Action Program for Children is that we get to be what the community needs us to be. As long as we're taking care of the needs of children and their families, we are able to provide the services that are necessary to provide in every community.
We meet the needs of our community.
Thank you to all our community partners. I am so happy to say that I've been a part of this program for 25 years, and I want to wish it a very happy 25th anniversary, and that I want to see it going on for more than 25 more years.
Great for our municipality to have been involved in it for the 25 years, so we're quite excited and hope it goes for the next 25 years.
Happy 25th anniversary, CAPC!
Happy 25th anniversary, CAPC!
Another one of our extraordinary programs is Telemental Health. Can you tell me a little more about that program?
Telemental Health is really one of our most innovative programs because it really leverages technology. The value proposition here at AFS is the right service, the right time, with the right people in the right place. But some of the challenges in delivering on that value proposition is that some of the people to provide that service aren't physically here, like child psychiatrists. So what Telemental Health does is actually connect us through technology to psychiatrists in Southern Ontario. And so we are one of 3 coordinating agencies in Northern Ontario. In fact, we are a lead agency for Telemental Health services. Last year alone, we had 900 referrals for Telemental Health. And those referrals are made by different professionals who are seeking consultation by a psychiatrist, either at the Hospital for Sick Kids, CHEO, which is the Children's Hospital of Eastern Ontario, or CPRI, which is the Child and Parent Resource Institute that have psychiatrists. So that's the cool thing. We're using the internet for perhaps with a web camera that actually has that on the psychiatrists in Southern Ontario and that on us here, and we do our consultation that way. And in some cases, having had worked in Southern Ontario, we actually have faster service because of that. So it's really incredible that our children and families can get that right service at the right time using that level of technology. That ensures children and families in Northern Ontario can have equal access to service compared to families in Southern Ontario. And we're really appreciative of the Ministry of Children and Youth Services, again, one of our 6 primary funders that helps support that program.
Wow. Let's take a look and learn more.
The Telemental Health program was designed so that children, youth, and their families from rural, remote, and underserviced areas in Ontario can access psychiatric consultations with psychiatrists who specialize in many different areas.
The Telemental Health program is a program that connects children, youth, and their families over video conference to psychiatrists in Southern Ontario so that they don't have to travel, and it alleviates the costs of traveling for health services.
Sick Kids in Toronto, CHEO in Ottawa, and CPRI in London are the 3 hospitals that have banded together to offer psychiatrists for our program.
The province of Ontario was divided into 6 different service areas, with us at Algoma Family Services being one of those 6 coordinating agencies. So essentially, we service the majority of Northern Ontario, overlapping with Delico and Wichita.
The Telemental Health program is for children and youth from birth all the way up to 18. Our psychiatrists are more than happy to help transition our youth into adult services, so they will stick around for a few appointments after the 18th birthday, but generally 18 is our age limit.
Any mental health professional from publicly funded agencies can refer to the Telemental Health program. So we see a lot of referrals come in from counselors, mental health leads from school boards, mental health nurses, and family doctors.
The type of clients that we see are children with behavior problems, ADHD, PTSD, trauma. We have some kids that have some eating disorders. We've seen kids and youth who are questioning their gender identity, and we have psychiatrists who specialize in a whole range of mental health disorders.
The appointments happen via video conference, connecting the patients, their families, and caregivers in rural areas with psychiatrists from other areas of Ontario.
Okay, why don't you come on in and I'll show you what to expect.
We can also connect more than one site, which is beneficial. For example, if a parent works in another community, we work to find video conference equipment close to the parents so that they can participate as well. The idea was to increase access and respond in a culturally competent way to the unique and diverse needs of our Northern Ontario communities. This is what you would see when you have a telemental health consultation.
Nikki and I might be in the same building, but you can be anywhere in Ontario and have this kind of conversation.
The Algoma Family Services Foundation is the only foundation that supports the mission of Algoma Family Services and their programs through multiple fundraisers in support of children and youth mental health programs.
The relationship between the Algoma Family Services Foundation and Algoma Family Services is a really important one. Since its establishment in 1994, the foundation has helped AFS provide a number of services, such as our psychology assessments, in a way we might not otherwise be able to do without the foundation's support.
In order for us to provide funding to Algoma Family Services, we run multiple major fundraisers throughout the year. One of those major fundraisers is the Great Escape Dream Draw, which takes place every spring with the draw happening in May. It gives our community the opportunity to support the foundation as well as earning a chance to win a large sum of money or a brand new truck and trailer. Another of our major fundraisers is the Golf for Kids tournament, which just finished taking place. It's a wonderful day where the community can come out, enjoy a round of golf, some great prizes, some delicious food, mingle with each other, and all supporting the efforts of children's mental health.
So the foundation has contributed approximately just over $1 million since its inception in 1994. With that money, we support a number of different programs, such as our group programs. We use the foundation funding to purchase our program supplies, our crisis follow-up that's allowed us to provide a level of service that we might not otherwise be able to, and also with our psychology assessments, which is a big one. Approximately over 20 assessments a year are paid for by the foundation fund.
The Algoma Family Services Foundation is led primarily by a group of board of directors, including our new chair, Mr. Sonny Spina, and one of our longtime board members, Mr. Jim Best.
Back in the early days, the foundation started with a large grant from one of the, I guess I'd say, clients of Judge Derek Holder back before I started, and that's back before '94. And it was, I think, in the terms of about $1 million. And from there, we were to use that money for servicing for the foundation that didn't get picked up by the government. However, as time went on, we realized that we just couldn't use that money. It was quickly depleting and had to come up with some other ideas in terms of keeping that money going.
Golf tournaments are a great fundraiser as they allow the community to come out and support the charity of their choice, but it's also an opportunity for them to enjoy a fun day outdoors, playing a game that they enjoy, and spending time with family, friends, or co-workers.
Over the years, we used different events to try to bolster up our money. Things like Savvy Seconds, which was a used clothing thing for the women. Of course, our Dream Draw, which was an instant success way back when. And along the while, about, I don't know, I can't remember how many years we've had the tournament, but a group of retired teachers led by Bob Pratt and boys put together a group to look at putting together a tournament, which started as a very small thing, but has since grown into a wonderful fundraiser for our foundation. And I think I've played in that since day one.
If the foundation did not donate funds, we'd be really in a difficult situation. We've had over a 22% increase in demand for service over the last 5 years. And with that increase in service, we haven't had an equal increase in support in terms of government funding. So the foundation fills a really important gap. Not completely, but without it, there would be even more children waiting for service and even more children waiting to get a psychology assessment.
Days like today are an example of why we do what we do. We want to thank the community for coming out to support us and just let them know that all of the funds stay local to help support Algoma Family Services through their children's mental health programs.
I hope you've enjoyed the show today and learned more about the great services at Algoma Family Services. If you'd like to learn more, please check us out on our Facebook page or give us a call. Thank you.